Hello, today's press conference will begin at 1 p.m.
All right. So welcome everyone to the Maricopa County press briefing for September 2nd, 2020. My name is Fields Mosley. I am the lead public information officer for Unified Command and the Joint Information Center during the pandemic that we're all dealing with COVID-19. I'd like to thank the reporters that are joining us via the webinar. You always have great questions, and we appreciate that. Also like to thank the folks that are joining us out there on Facebook and YouTube. We appreciate you coming to us and finding out more information through these press briefings that we do at least every other week. So today we're going to be talking about an important study that's coming up very quickly this month, and it's a project that will launch in a couple of weeks. It's called a Serosurvey. These studies have been going on across the country in various ways in an attempt to better understand the spread of disease in our community by going out and doing special testing with randomly selected members of our community. And Executive Director of Maricopa County Department of Public Health, Marcy Flanagan, she will be filling us in on some of the details of this project and what's coming up with that. Also with us today for the question and answer portion of the press conference, I do have Director Robert Rowley. He is the Director of Emergency Management for Maricopa County. So if you have questions about personal protective equipment, things that we've been providing to schools, long-term care facilities, things like that, he can have an update on where we are with those programs. So a few housekeeping items before we get started here today. Members of the media, you will be called upon by our moderator once you have your hand raised virtually in the GoToWebinar, and he will call upon you. You have to unmute yourself on your end, whatever device you are on, so we can hear you, and we will unmute you on this end, and you'll be asked to go ahead with your question. So if you're having some difficulty with the GoToWebinar software, you might have to log out, log back in, and that usually solves the problem. We're almost always able to get around to second, sometimes even third questions if you have follow-up questions. Please try to limit your questions to one, maybe two at a time. That certainly helps us as far as answering. We also have Joanna Molina with us today, translating in Spanish, and of course our ALS interpreters as well, who will be helping there. But keeping it to one question at a time certainly helps us with that. So as Director Flanagan comes up here, she's first going to, before we talk about Serosurvey, we've had a lot of questions, especially on social media, about how public health and the epidemiology team at public health counts deaths. And there have been some sort of, I guess I'll call it controversy or misunderstandings about how these things are counted at the public health level versus the medical examiner level in coroners in certain counties across this country. It varies to some extent, but Director Flanagan will address that first and then talk about the Serosurvey.
Good afternoon. I'm Marcy Flanagan, Executive Director for the Maricopa County Department of Public Health. So as Field said, first I'm going to talk a little bit about COVID-related deaths in Maricopa County. So determining the cause of death for an individual is a different process than how Maricopa County Department of Public Health counts associated deaths with conditions like the flu, heat, or even COVID-19. Public health uses disease surveillance, which is data-driven processes that all health departments and the CDC use to track diseases, outbreaks, and outcomes. The goal of some disease surveillance process is to quickly understand what is happening with the disease or the disease outcome. The results are quick, but the numbers can be imperfect. Healthcare providers or medical examiner fill out death certificates after reviewing a record and determining the most likely cause of death based on the information they have. Death certificates can be imperfect record because they are signed quickly under state law, and a healthcare provider may not have all of the information about why a patient has died. A healthcare provider may go back and update the death certificate when they have obtained additional information. For COVID-19 death surveillance, Maricopa County Department of Public Health uses death certificate and laboratory test information to estimate the number of COVID-19 associated deaths in the county. For example, COVID-19 was probably associated with the death of a person due to a heart or lung related condition shortly after being diagnosed with COVID-19, even if COVID-19 was not listed on the death certificate. In order to capture most of the deaths associated with COVID-19, those diagnosed with a COVID-19 positive PCR test who die within 60 days are considered COVID-associated deaths in Maricopa County Public Health's death surveillance numbers. As of Tuesday, August the 25th, there were 2,804 deaths where COVID-19 was present. 7 of these, or 0.02 of all these deaths, had resulted from injury or poisoning without COVID-19 being listed on the death certificate. These account for things like trauma, car accidents, gunshot wounds, and even drug overdoses. Data on COVID-19 associated deaths will be reviewed regularly to remove from the counts those who died due to causes such as car accidents, gunshot wounds, or drug overdoses, if COVID-19 is not otherwise listed on the death certificate. Data on disease-associated deaths are frequently reviewed in more detail, often requiring things like medical records to be reviewed. This happens after outbreaks are over to finalize the number of deaths caused by and associated with a disease. We know that any COVID-19 death surveillance likely undercounts the number of people whose deaths are associated with COVID-19, and this is probably reflected in the increase of all-cause mortality during this pandemic. We will have the final count of deaths caused by and associated with COVID-19 after the pandemic. So next, I'm going to switch gears a little bit and talk about the Serosurvey we'll be conducting in September. A Serosurvey estimates how many people have antibodies in a certain infection. An antibody is a protein which the body makes in response to a specific infection. We know that in other parts of the U.S., Serosurveys have estimated as many as 10 times the number of people infected than were reported to public health through routine disease surveillance based on positive lab results. This is mainly because people either don't know that they were infected and did not seek out care, but ultimately they did not get tested. This could have been because they didn't have any symptoms, or maybe they thought it was something else, or that testing was not available when they were sick. The Serosurvey will give us a better idea of how many people in the county are likely immune to the virus for at least a period of time. Our goal is to understand when we have reached community immunity or herd immunity, which is when enough people in our population are immune to a disease so that it can't spread effectively. We are still learning what proportion of the population needs to be immune to COVID-19 before we reach this herd immunity, but there are estimates that it could be as low as 30 to 40%. The information we get from the Serosurvey will give us an idea of how many people at this point in time have antibodies to COVID-19 from being naturally infected and likely immune to getting it again. This will help us determine how many people need to get vaccinated in Maricopa County once a vaccine is available, and also relaxed strategies for social distancing and our mask recommendations. We will be going door to door in 29 selected neighborhoods across Maricopa County. These neighborhoods were selected by the CDC and are representative of a sample of Maricopa County community. Our goal is that 500 individuals or 210 households participate. Households in these 29 neighborhoods will add up to a representative sample of the overall county. We are following a CDC-validated method for representative sampling of the whole community. Anyone age 6 and up can participate in this Serosurvey. If your home is one of the selected areas, you'll get a notice on your front door next week letting you know that we'll be in your area between September 12th and the 20th. During that time, field teams with public health and ASU volunteers will be going door to door in teams of 2. During that time, the field teams with public health and ASU volunteers will have official shirts and badges to identify them as representatives of either public health or ASU. Your participation is entirely voluntary. If you choose to participate, volunteers can set up a tent outside so they will not have to enter your home. They will wear PPE and ask you some questions about the health of anyone in your household, and then they will take small blood samples from anyone in your household who is willing to participate. If you prefer, you can also schedule an appointment at our mobile clinic to participate. Your sample will be sent to the Mayo Clinic anonymously for testing with only a code on it to identify it to public health. After the sample is tested for antibodies, you will receive a phone call from public health with your results. All samples will be destroyed after the investigation, and no one outside of public health will have access to any identifying information. We know that many questions are going to be out there about this Serosurvey. We are making people's safety, both residents and volunteers, the highest priority. All volunteers stay 6 feet away from people's doors when they first speak to residents. They will wear official Maricopa County Public Health volunteer shirts or ASU shirts. They will also have public health volunteer badges on. If you choose to participate, volunteers will put on new PPE while you participate. You have the option of participating at your home in a tent with equipment that is new or sterilized. You will also have the option of participating at a mobile clinic, which is sterilized between uses. Volunteers will not ask to come inside your home at any time. We are working with emergency responders, local law enforcement, and local emergency managers to ensure that if you are concerned about someone who approaches your home, you will have ways to verify that they are legitimate volunteers and part of our Serosurvey. Additionally, your information will not be shared with anyone outside of public health. Your sample will be given a code that only Maricopa County Public Health will have attached to your name. So even the lab will not have your name attached to your sample. Your sample will be destroyed after the COVID-19 antibody test is run. We want everybody in these communities to feel safe and comfortable participating in our Serosurvey. We will have more information available on our Serosurvey webpage, which is maricopa.gov/COVID-19 Serosurvey. It will also include on the website photos of what our volunteers will look like and the door hanger that you can look for starting next week if your neighborhood is one we will visit. We are thankful for all the partners in the community for this Serosurvey. We're proud to be partnering with ASU and Mobile Clinic to make this happen. Thank you, ASU, for providing the volunteers and coordination of this Serosurvey, and thank you, Mayo Clinic, for running the lab tests. We are also grateful to our many community partners who will be supporting this effort. So wrapping up today, while our numbers are low and much lower than they were last time last month, we still need everyone to continue taking the proactive actions that got us to this point, which are practice social distancing, wear a cloth face covering when you go out in public, wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer if you cannot wash your hands. Monitor yourself and your family for COVID-19 symptoms and stay home as much as possible, especially when you are sick. Thank you.
Thank you so much, Director Flanagan, for all that good information. A couple of big subjects there, especially the Serosurvey that is coming up rapidly. As she said, you'll be getting notifications next week, or you'll see those door hangers in your neighborhood about volunteering for this important survey to better understand the spread in our community. So at this point, we'll open it up to questions from reporters who are on the webinar. And Chad, do we have anybody waiting?
We don't at the moment. Let's give it a couple of seconds and see if anyone comes up with a question.
Okay. A quick reminder while we wait for somebody to raise their hand on the webinar. Rob Rowley, our Director of Emergency Management, also here if you have any questions as well for him. He put on a tie today.
We'll go ahead and start with Peter Seymour. Peter, if you'll unmute the microphone on your end, you're ready to go.
Are you there, Peter?
Now I'm here. Can you hear me now?
I can.
Very good. Thank you. Sorry about that. So I wanted to ask, is there any information the county can give on the Department of Health Services from the state offering contracts to counties, $50,000 worth to enforce social distancing and other types of things to other types of businesses who are not following protocols to prevent COVID-19?
Yes, Peter, we can say about one sentence on that, but I'll ask Director Flanagan to come up and give you an official statement.
Thank you for the question, Peter. So at this point, we are still under contract negotiations with the state about that. So we can't say a lot of details about that, but I know there's been media attention, but at this point, Maricopa County is still under negotiation with the Arizona Department of Health Services.
Thank you, Peter, for the question. Chad, do we have somebody else? Oh, my apologies. I'm a little rusty. Joanna will come up and translate that.
La pregunta es que si nos puede dar información acerca de que el Estado estará ofreciendo $50,000 a los condados para poder coordinar el distanciamiento social en los negocios o monitorearlo. Bueno, al momento lo que podemos decir es que estamos en negociaciones con el Departamento de Salud del Estado. No se ha hecho ningún tipo de arreglo al momento, solamente son negociaciones.
Okay, now, Chad, do we have somebody else with a question?
We do. Ben Giles has our next question. Ben, if you'll unmute, you're ready to go.
Hi, guys. Just wondering what neighborhoods should be on the lookout for door knockers or those flyers on their door come next week. And people, I think you said starting September 12th is when those volunteers will be out in the field.
So, Ben, I think it's fair to say we know which neighborhoods they've been chosen already. Director Flanagan can elaborate on that a little bit more anyway. I mean, we don't have the list in front of us, I think it's fair to say.
We don't have that information with us right now. We have already identified those 29 communities, and we will provide them on our website, the website I shared earlier.
La pregunta es que si qué vecindarios serán los seleccionados para esta encuesta de anticuerpos a partir de este mes de septiembre. No tenemos la lista con nosotros, pero sí se podemos decir que son 29 vecindarios o comunidades que estarán siendo seleccionadas y estarán enlistadas en nuestra página de internet próximamente.
And that website is maricopa.gov/COVID-19 Serosurvey, correct? correct. And we plan on having that list up. I don't want to overpromise here, but probably by the end of the day, that list of the communities that will be involved in the Serosurvey and members of those communities. Obviously, not everybody in the community will receive testing or volunteer for that testing, but that list will be up on the web page, hopefully by the end of the business today. So, Ben, you can look for it there. Chad, do we have somebody else?
We do not have any more pending questions.
Okay, I'm going to give people about 2 more seconds here.
It looks like Stephanie Inez has a question now.
Okay.
Stephanie, your microphone's unmuted. Go ahead.
Hi, yes, I was wondering if Maricopa County was issuing any guidance to residents about the Labor Day weekend that they should be following for COVID. And looking ahead, would that be about the same guidance they're going to give on for Halloween, or do you think Halloween's going to be canceled this year?
I can't speak to Halloween being canceled, judging by the product in local stores. It hasn't been. Has anything changed? Director Flanagan will come up and answer that. But Stephanie, to be fair, I think it's the guidance is going to remain the same. There's no planned changes in the guidance whenever it comes to social distancing, 6 feet, keep it limiting the number of large groups or the members of your group, and wearing your mask. So Director Flanagan giving me the thumbs up that that is the guidance we are offering at this point. I'll have Joanna come up and translate really quickly.
Y la pregunta es que si estamos dando alguna guía o recomendaciones ahora que se acerca el día festivo del Día del Trabajo con relación a COVID-19. Bueno, esta guía no cambia, es la que hemos estado dando hasta el momento, que es exactamente mantener el distanciamiento social de 6 pies o más y también quedarnos en casa si estamos enfermos y no estar en grupos mayores de 10 personas a la vez.
I hope everyone's pleased to know that Maricopa County doesn't intend to cancel Halloween. So wear your costume, I suppose. So Chad, do we have somebody else with a question? And Stephanie, thank you for the question. It's a good one.
We do not.
All right. Well, I hope people aren't struggling with raising their hands on GoToWebinar, but I'll take that as an indication that we gave you plenty of information about the Serosurvey, perhaps offered some clarification today about how the epidemiology team is counting deaths. And thank you so much for joining us today on Facebook, YouTube, and of course the reporters. Thanks for being with us and asking good questions as always. We will let you know when our next availability is. Thanks again.